If you're a BCBA looking to expand your horizons beyond the typical setting of working with children on the autism spectrum, you are in for a treat. Today, we are going to explore the diverse populations where your skills can make an impact. Whether you are just starting out or looking to switch things up a bit, this video will tell you where your expertise is needed the most. BCBAs play a crucial role in working in early intervention population. This could include working directly with the infants or toddlers who are starting to show signs of a developmental delay. In this setting, you may create an individualized program that will help these young children develop skill at a very early age. Another area could be within the schools or the educational system. So this might be working within a special education classroom or even in a general education classroom. You may help to support with the development of behavior intervention plans. You may also help to support this teacher with learning classroom management strategies, or even provide direct support to the students. BCBAs are increasingly being integrated into the medical setting. Within this medical setting or mental health setting, a BCBA can help to support individuals who have severe behavioral needs or behavioral problems. So within this setting, you may provide direct support to individuals that have behavioral disorders such as schizophrenia, bipolar, or even severe depression. As I'm sure you may know, you want to make sure that all of the areas that I am suggesting today, you either have a mentor or someone that you can consult with if it is that this has not been a population that you have explored or that you have worked with in the past. As a BCBA, you can also work with the geriatric population, particularly with helping to manage dementia-related behaviors or other behavioral disorders. You may help to develop a program or a plan that helps the elder to maintain their independence, or you may work in tandem with their caregiver to help with managing some challenging behaviors. BCBAs can also be instrumental in substance abuse treatment in a way that you can use behavioral analysis to help someone to overcome addiction. You may work directly with clients to help them to modify their behaviors that contribute to their substance usage, or you can help to design a program that reinforces sobriety and a healthier living lifestyle. These are just a few roles that a BCBA can elect into that kind of changes things up from what we all traditionally know as the work that a BCBA does. I also recognize that sometimes it can be very difficult for you to identify someone who may specialize in this area that can consult with you or supervise you throughout the process of making that switch. Therefore, if it is that you either specialize in one of the areas that I mentioned today, or if you know someone who specializes in that area, please drop it in the comments so that we can all support each other as we navigate the various roles that one can do as a BCBA. So if you found this video helpful, please be sure to like and subscribe, and I'll catch you in the next video. Bye for now.